Let's start with some basic definitions to help you understand some of the components of this topic. Hyperthyroidism, to start with, is where there's overproduction of thyroid hormone by the thyroid gland. Thyrotoxicosis refers to an abnormal and excessive quantity of thyroid hormone in the body. Primary hyperthyroidism is due to thyroid pathology, so it's the thyroid itself that's behaving abnormally and producing too much thyroid hormone. Secondary hyperthyroidism is a condition where the thyroid is producing excessive thyroid hormone as a result of overstimulation by thyroid stimulating hormone. So the pathology is in the hypothalamus or the pituitary producing too much TSH, and that's what's causing the high thyroid output. Graves' disease is an autoimmune condition where there's TSH receptor antibodies that are causing the hyperthyroidism. And these TSH receptor antibodies are abnormal antibodies that are produced by the immune system, and they mimic TSH and stimulate the TSH receptors in the thyroid gland and cause them to secrete thyroid hormone. And this is the most common cause of hyperthyroidism. Toxic multinodular goiter, which is also known as plumber's disease, is a condition where there's nodules developing in the thyroid gland, and these nodules act independently from the normal feedback system and continuously produce excessive thyroid hormone. Exophthalmos is a term that's used to describe the bulging of the eyeball from the eye socket, and this is caused by Graves' disease and is due to inflammation, swelling, and hypertrophy of the tissue behind the eyeball that's forcing the eyeball forward. And final definition is pretibial myxedema, and this is a dermatological condition where there's deposits of mucin under the skin on the anterior aspect of the leg, or the pretibial area. And this gives a discoloured, waxy, edematous type of appearance to the skin over this area. And it's very specific to Graves' disease. And it's caused by a reaction of the tissues under the skin to the TSH receptor antibodies. So what are the universal features of hyperthyroidism? So the universal features of having a high thyroid hormone level in the body: anxiety and irritability, sweating and heat intolerance, tachycardia or fast heart rate, weight loss, fatigue. Even though they have a high thyroid hormone level, they're going to feel exhausted all the time. The thyroid hormone also stimulates the bowel, so you get frequent loose stools, and they can have sexual dysfunction as well. There's a couple of features that are unique to Graves' disease, and these all relate to the presence of TSH receptor antibodies. So you can have a diffuse goiter without any nodules, thyroid eye disease, which is what we talked about, this exophthalmos, and pretibial myxedema. Some of the features of toxic multinodular goiter: so you'd have a goiter, and then when you palpate it during your thyroid exam, you'd feel firm nodules. Most patients with toxic multinodular goiter are above 50 years old, and just as a reference point, toxic multinodular goiter is the second most common cause of thyrotoxicosis. A solitary toxic thyroid nodule is where there's a single abnormal thyroid nodule that's acting on its own to release thyroid hormone, and these nodules are usually benign adenomas, and they're treated quite easily by surgical removal of the nodule, which will stop the excess thyroid hormone from being produced. There's a condition called de Quervain's thyroiditis, and this describes a presentation of a viral infection with fever, neck pain and tenderness, dysphagia, and features of hyperthyroidism. And this is where there's a viral infection that's causing a bit of pain and inflammation in the thyroid gland. There's a hyperthyroid phase, and this is followed by a hypothyroid phase as the TSH levels fall due to negative feedback from the high thyroid gland. And then after the hypothyroid phase, thyroid function tests will return to normal. And this is a self-limiting condition, and all that's really required is some supportive care, usually with non-steroidal anti-inflammatories like ibuprofen to help with the pain and the inflammation, and some beta blockers for symptomatic relief of the hypothyroidism if required. Next, let's talk about a concept called thyroid storm. And thyroid storm is a rare presentation of hypothyroidism, and it's also known as thyrotoxic crisis. And this is where there's a more acute, severe presentation of the hypothyroidism, where the patient will get pyrexia, tachycardia, and may have a delirium as well. It requires admission for monitoring, and it's treated pretty much the same way as other presentations of thyrotoxicosis, although they might need more supportive care with fluid resuscitation, antiarrhythmic drugs if they've gone into AF or some other arrhythmia due to the thyrotoxicosis, and beta blockers can be helpful to treat the symptoms.